Mhm. Okay, so good evening, everyone. We are Group 1, and we're here tonight to present our case study, Spontaneous Abortion. So, allow me to read our case study first. So, patient C is a married woman, 15 years of age, gravida is 1 and para is 0, at 7-week gestation, according to her last menstrual period. This is a planned and welcome pregnancy. She called the office with complaints of bright red bleeding, lighter than a menstrual period, but requiring sanitary pad protection. She also reported intermittent cramping. She denied lightheadedness, dizziness, nausea, vomiting, or focal pain. Although she had not experienced any nausea or vomiting, she reported continued breast tenderness. On arrival in the office, her vital signs were obtained. Her height was 65 inches, weight is 142 pounds, blood pressure is 112 over 68 mmHg, the pulse is 76 beats per minute, and she appeared to be in some discomfort from the cramping. But her color was good and she was able to answer questions without difficulty. Upon questioning, she denied any trauma, recent intercourse, or changes in discharge preceding the onset of bleeding. Her last pap test was done for months previous and was normal. Routine cervical cultures at that time were positive for chlamydia and gonorrhea. For the pelvic examination, pelvic examination reveals the following. External genitalia, a small amount of dark red blood is noted at the vaginal introitus. No lesion, trauma, or lacerations are noted. Vagina, pink, a small amount of dark red mucinous blood is noted in the vaginal vault. No trauma or lacerations are visible. And for the cervix, it appears to be closed, pink without exudates or lesion. A small amount of dark blood is noted coming from the cervical OS. And the bimanual exam indicated a 7 to 8 week gestation size, anteverted uterus, mildly tender to palpation. No, no adnexal masses were appreciated, and the cervix felt closed. And the results of her laboratory studies indicated that her blood type is A, Rh positive, antibody screen is positive, CBC is hematocrit and hemoglobin, and her HCG is 2,400 milli international unit per milliliter. And an ultrasound examined was performed. An intrauterine pregnancy was noted with a fetus and fetal cardiac activity of 136 beats per minute. A normal gestation sac was seen consistent with the pregnancy of 7 weeks, 2 days. The, the placenta was low lying but did not cover the cervical OS. No subchorionic hemorrhage was apparent.
Good evening, ma'am. I am Antoinette Borja together with Abigail Abkawili, and we are tasked for the introduction of abortion. First, is abortion is the ending of pregnancy by removing a fetus or embryo before it can survive outside the uterus. If the or weight is less than 500 grams at 20 weeks of gestation, the expelled embryo or fetus is called abortion. It can be induced or it's spontaneous. Spontaneous abortion is defined as the involuntary loss of the products of conception prior to the type to 20 weeks of gestation. There are also types under the spontaneous abortion. First, is the threatened abortion, an abortion characterized by slight bleeding through an undilated cervix. The other one is the inevitable abortion. It is said to be inevitable. It can no longer continue. It may be complete or incomplete. Next is the incomplete abortion, in which parts of the product of conception, usually the fetus, is passed, while the placenta and membrane are retained. Complete abortion happens when all the products of conception, the embryo, placenta with intact membrane are expelled from the uterus. Misabortion, when a pregnancy stops developing, where the embryonic tissue or the gestation sac remains in the uterus and the cervical OS is closed. Recurrent abortion also refers to as recurrent miscarriage or habitual abortion. Is historically defined as 3 consecutive pregnancy losses prior to 20 weeks from last menstrual period. The other types is the induced abortion. Is the medical or surgical termination of pregnancy before the time of fetal viability. For the signs and symptoms, severe pain or cramps low in the abdomen, and severe bleeding with or without pain, vaginal discharge, contain pregnancy tissue, dizziness or fainting, chills or fever higher than 100.4 degree Fahrenheit, sudden loss of pregnancy symptoms such as morning sickness, breast tenderness, and more, and back pain often in lower back. Abortion may due to maternal causes such as maternal infection, maternal diseases, drugs, and hormonal disturbance. It can also be due to fetal causes such as chromosomal anomalies, blighted ovum, hydatidform moles, congenital defects. Other causes may of include uterine developmental anomalies, surgical during pregnancy, and environmental factors such as cigarette and alcohol. For the nursing management, for the nursing management, next slide please. If bleeding is profuse, place the woman flat in bed on her side and monitor uterine contractions and fetal heart rate through an external monitor. Also, measure intake and output to establish renal function and assess the woman's vital signs to establish maternal response to the blood loss. Measure the maternal loss by the maternal blood loss by saving and weighing the used pad. Save any tissue found in pads because this might be a part of the product of conception. You can also done the post-operative care and discharge instruction to the patient.
Okay, for the medical management, a certain drug such as a form of prostaglandin E or the misoprostol is given which stimulates uterine contraction that aid in expulsion of remaining tissue and endometrium. Miscarriage may be followed by blooding for several weeks, changing from bright red to pink in color. Excessive bleeding should be promptly controlled by administering Metergine 0.2 mg if the cervix is dilated and the size of the uterus is less than 12 weeks. The blood loss is corrected by intravenous fluid therapy and blood transfusion. Prophylactic antibiotics are given. Removed materials are subjected to a histological examination. So for the surgical management, first is the dilatation and evacuation. This is to make sure that all products of conception would be removed from the uterus. However, before undergoing this intervention, the physician must be sure that no fetal heart sounds could be heard anymore and the ultrasound must show an empty uterus. Other management can be dilatation and curettage. This is most commonly performed for incomplete abortions to remove the remainder of the products of conception from the uterus. Since the uterus would not be able to contract effectively, the content might be trapped inside and could cause serious bleeding and infection. Okay, now for the statistics. So, for the incidence of abortion internationally, around 73 million induced abortions take place worldwide each year. 6 out of 10 or 61% of all unintended pregnancies and 3 out of 10 or 29% of all pregnancies end in induced abortion. Complications from unsafe abortion can have severe mental and physical health implications and account for approximately 4.7 to 13.2% of maternal deaths worldwide. This number is likely even higher in fragile and conflict-affected countries where many may lack access to basic healthcare services. So for the national, 1.1 million induced abortions occur in the country annually, a number that was estimated to increase by 14.6% in 2020. Each year, 4.7 to 13.2% of maternal deaths can be attributed to unsafe abortion. In developed regions, it is estimated that 30 women die for every 100,000 unsafe abortions. In developing regions, that number rises to 220 deaths per 100,000 unsafe abortions. So for the significance of this study, in summary, conducting these studies on abortion is significant as it contributes to scientific knowledge, informs evidence-based policies and healthcare practices, addresses public health concerns, promotes reproductive rights, and fosters informed discussions. These studies plays a crucial role in advancing our understanding of abortion and its broader societal applications. Studying abortion helps researchers and healthcare professionals understand the various factors that influence women's decisions regarding pregnancy termination. This knowledge contributes to the development of comprehensive reproductive health services including counseling, safe abortion procedures, and post-abortion care. It helps identify potential risk complications and adverse outcomes associated with different abortions methods. By studying the effectiveness and safety of various abortions procedures, researchers can contribute to the development of guidelines and protocols that enhance the quality of care and minimize risk for women.
So good day, ma'am. I'm Jasmine Corpus. So for today, we will present the nursing health history together with Felicity Asom. So next. So for the patient's profile, name is patient C, age 15, sex is female, the civil status is married, address is Tuguegarao City, Cagayan, religion Roman Catholic, weight is 142 pounds, height is 65 inches, and the age of the station is 7 weeks, and the obstetrics story is Gravida 1 para 0. Next po. And for the history of present illness, patient C, a 15-year-old female, has a history of unprotected sex. 4 months ago, she had undergone pap tests and her routine cervical culture revealed a positive gonorrhea and chlamydia. She also mentioned that she smokes and drinks alcohol often with her husband at night. Next po. And for the past health hist- and for the past health history of the patient, patient C received the childhood vaccines, but her parents did not receive any childhood vaccine since it was not yet available during their time. Her mother also has a history of miscarriage before 20 weeks age of gestation. Patient has as, asthma because of smoking at least 3 to 5 sticks a day and drinking alcohol in moderation together with his husband. She use she uses salbutamol inhaler to help reduce the sign and symptoms of asthma. So next po.
So for the family health history, according to the patient, her mother and grandmother is hypertensive and has diabetes mellitus. They both also had a history of miscarriage during their pregnancy. Her father has hypertension and asthma. He takes losartan as a maintenance medication. Next po. And for socioeconomic history, the patient is elementary graduate. She is a housewife and lives in a small house with her husband. She has a bad relationship with other people, including to her parents. And according to the patient, significant other, sometimes the patient smoke and drink alcohol in moderation during her pregnant due to her family situation. She feels stressed when it comes to their situation at home. Her husband has a minimum income and it is not enough to meet their basic needs. Next po.
So good evening, ma'am. I am Joy Angeline Balukay together with Miss Kyla May Axon, and we will be the one to discuss the pathophysiology of abortion.
So, what is pathophysiology? Pathophysiology is the study of how a disease, injury, or other condition affects a patient, including both the physical and functional changes that occur. So, pathophysiology consists of risk factors such as predisposing and precipitating factors. We also have the etiology, which is the causative agent, pathogenesis, which is the disease process, and the clinical manifestation that are present to the patient. So first, we have here the predisposing factor. When we say predisposing factor, it is the condition of activities that can lead to the develop of disease within a living organism. So, so the available data here that is based from the patient record is age of 15 years old and positive chlamydia and gonorrhea. So there are other predisposing factors that are not available from the patient record. We have included this for additional knowledge of everyone. This include previous miscarriage, chronic condition, uterine or cervix problem, and invasive prenatal tests. And then second is precipitating factors are factors that cause or trigger the onset of a problem such as a disease, disorder, or illness. So the available data, lifestyle factors, smoking and drinking alcohol. So the etiology is unknown, which means idiopathic.
So for the pathogenesis of the abortion, so upon admission, the patient is diagnosed with positive chlamydia and gonorrhea. Due to the presence of these STDs, there is a response to epithelial cells and immune cells. So upon ascending of infection to the cervix, there is a rapid release of inflammatory response such as the cytokines and chemokines, which cause epithelial damage. So if there is a direct damage to the tissues, it causes decrease or fall of HCG level, which result in death of trophoblastic tissue and intermittent pain or abdominal pain. So the trophoblastic, so the death of the trophoblastic tissue will then leads to no fetal cardiac activity. So the direct damage to tissues also causes vaginal bleeding, intermittent cramping, and cervix close, which are these are all manifested by the patient. So this manifestation can leads to collapsing gestational sac. So the collapsing gestational sac and the no fetal cardiac activity resulted in intrauterine fetal death or miscarriage. So that's all for the pathophysiology of abortion.
So, good evening, ma'am. I am Bernadette Barrera, and we will going to present the laboratory study together with Miss Tishane Apias. So, this is the laboratory study prior to admission. So, first is we have the complete blood count or CBC. So, the normal findings are 6 to 16 times 10 raised to 9 per liter. Then the result prior to admission is 8 times 10 raised to 9 per liter. The analysis is normal, and the rationale is this is to provide information on the hematologic system as well as other body system. This is commonly performed that is often included as a part of a routine checkup. Then for the hemoglobin, normal findings is 11 grams per deciliter. The result prior to admission is 9.7 grams per deciliter. The analysis is deviated from normal. A hemoglobin test is often used to check for anemia. Next is the white blood cell. So the normal findings are 5,000 cubic millimeter to 15,000 cubic millimeter, and the result prior to admission is 18,000 cubic millimeter, and it is deviated from normal. And this is to diagnose disorders related to having a high white blood cell count, to having white blood cell count or low white blood cell count. So next is the hematocrit. The normal findings is 33%, and the result is prior to admission is 30%. So it is deviated from normal. Hematocrit test is a part of a complete blood count. This is to determine the percentage of RBC in the blood. Next is the platelet count. So the normal findings are 150,000 to 400,000 cubic millimeter, and the result prior to admission is 211,146 cubic millimeter. The analysis is normal, so platelet count test is a part of complete blood count. It is used to monitor or diagnose conditions that cause too much bleeding or too much clotting. So we have the HCG or the human chorionic gonadotropin. So the normal findings are 32,000 to 200,000, 210,000 milli international unit per milliliter, and the result prior to admission is 2,400 milli international unit per milliliter, and it is deviated from normal. Measuring HCG levels can be helpful in identifying a normal pregnancy, pathologic pregnancy, and can also be useful allowing an aborted. Then we have NAAT or the nucleic acid amplification test. So the normal findings must be negative for viral or bacterial infection, but the result prior to admission is positive for Neisseria, gonorrhea, and Chlamydia trachomatis infection. So it is deviated from normal, and it is used to screen out gonorrhea and chlamydia. So for the upon admission, Ms. Tishane Apias will present.
So upon admission, the complete blood count of the patient is 8 by 10 raised to 9 per liter. So the normal findings should be 6 to 16 by 10 raised to 9 per liter. So their rationale is this is to provide information on the hematologic system as well as other body system. This is commonly performed that is often included as a part of a routine checkup. So for the hemoglobin of the patient upon admission is 9.7 grams per deciliter, and the normal findings should be 11 grams per deciliter. So the analysis is deviated from normal. And the rationale is a hemoglobin test is often used to check for anemia. And for the white blood cell, the result of the patient's white blood cell upon admission is 18,000 millimeter cubic millimeter, and the normal findings should be 5,000 cubic millimeter to 15,000 cubic millimeter, and the analysis is deviated from normal. So this is to diagnose disorders related to having a high white blood cell count to having white blood cell count or low white blood cell count. Then for the hematocrit, the result is 30%, so the normal findings should be 33%. So the analysis is deviated from normal. So for the rationale, hematocrit test is part of a complete blood count, and this is to determine the percentage of red blood cell in the blood. So for the platelet count, the result is upon admission is 211,146 cubic millimeter, and the normal findings should be 150,000 to 400,000 cubic millimeter. So their analysis is normal, and the rationale is platelet count test is part of complete blood count. It is used to monitor or diagnose conditions that cause too much bleeding or too much clotting. So for the HCG, the result is 1,500 milli international units per milliliter, and the normal findings should be 32,000 to 210,000 milli international units per milliliter. So the analysis is deviated from normal, and for the rationale, measuring HCG levels can be helpful in identifying a normal pregnancy. Pathologic pregnancy can also be useful following an aborted pregnancy. So for the nucleic acid amplification test, the the result is positive for Neisseria gonorrhea and chlamydia trachomatis infection. So the normal should be negative for viral or bacterial infection. So the analysis is deviated from normals, and the rationale is it is used to screen out gonorrhea and chlamydia.
Good evening, ma'am. So, I am CJ and I will be presenting the first and second nursing care plan. So, next slide, please. So, we have here the nursing care plan number one. It is the maternal injury related to spontaneous abortion. Here we have the assessment. We have the objective data. It is intrauterine fetal death. The diagnosis is maternal injury related to spontaneous abortion. So we have the planning throughout the 8-hour shift. The patient will prevent any maternal injury and future complications. So we have here the implementation. The first one is ensured a safe environment. This is to prevent falls and additional injury. Second is offered non-pharmacological pain management techniques such as relaxation techniques or distraction methods. This is to ease the pain that the patient is currently having. Next, we have the discuss the client's future reproductive plans and provide information about family planning options if desired. Next is we have the educated client about the importance of follow-up checkups, care, and attending scheduled appointments. Next is we instructed the client to report any signs of infections promptly, such as fever, increased pain, or abnormal vaginal discharge. Next is we administered prescribed medications such as NSAIDs like ibuprofen as ordered. The evaluation is after the 8-hour shift of nursing interventions, the patient is prevented any maternal injury and other complications. The second NCP is the risk for bleeding related to intrauterine fetal death. For the assessment, we have the objective data, intrauterine fetal death. The diagnosis is risk for bleeding related to intrauterine fetal death. The planning, we have the throughout the entire hour 8-hour shift, the patient will prevent excessive bleeding and complications. So first one, this we have monitored vital signs frequently and assess for signs and bleeding or hemorrhage. This is to establish baseline data. Next is we provided education on measures to prevent bleeding, such as avoiding strenuous activity, heavy lifting, and refraining from sexual intercourse until advised by the healthcare provider. Next, we administered IV fluids and blood products as prescribed to maintain hemodynamic stability and to provide additional electrolyte and to prevent dehydration. Next is we have instructed the client on proper perineal hygiene to reduce the risk of infection. Next is we have provided information on healthy coping strategies including adequate rest, nutrition, and hydration. This is to promote faster healing and recovery. The evaluation after 8-hour shift of nursing interventions, the patient prevented excessive bleeding and other complications.
Okay, so hello ma'am, my name is Kasnernik Mag-ili and my part is to discuss the 3 and 4 nursing care plan. Okay, so for the number 3 nursing care plan is risk for infection related to surgical procedure and positive culture on gonorrhea and chlamydia. For the assessment, for the subjective data is fatigue, the objective data, temperature of 38 degrees Celsius, surgical incision, a positive culture on gonorrhea and chlamydia. For the diagnosis, risk for infection related to surgical procedure and positive culture on gonorrhea and chlamydia. For the planning, throughout the 8 hours shift of nursing interventions, the patient will demonstrate techniques to reduce the risk of infection and achieve timely healing. For the implementation, the first one is to educate client on proper hand hygiene and wound care techniques, including how to clean and dress the surgical site using aseptic techniques. This is to prevent infection and to promote wound healing. The second one is to encourage abstinence of safe sexual practices until the infection is cleared and provide information on partner notification and treatment. This is to prevent the spread of infection to partner and allows the body to heal. For the third one is to encourage client to maintain adequate hydration and provide information on the importance of proper nutrition for wound healing. And the fourth one is to offer emotional support and reassurance to alleviate anxiety or fear related to the infection and surgical procedure. This is to help relax their feelings, creating a more positive mindset and reduce stress. The fifth one is to provide education on the importance of taking antibiotics as prescribed and completing the full course of treatment. This is to eliminate the infection completely. And for the evaluation, the goal partially met. After the 8 hours shift, the patient demonstrated techniques to reduce the risk of infection and healing will take time to be achieved. And for the fourth one, nursing care plan is grieving related to fetal death. For the assessment, the objective data, ultrasound shows intrauterine fetal death. For the diagnosis, grieving related to fetal death. And for the planning, after 1 hour of nursing interventions, the patient will demonstrate effective coping mechanism and shows acceptance toward the situation. For the implementation, create a safe and non-judgmental environment for the client to express their emotions and thoughts about the loss. This is for the client to feel comfortable and share her emotions. Number two is to discuss coping strategies and self-care activities that may be helpful during the grieving process. This is for her to learn effective ways to manage their grief. For the third one is to promote healthy coping mechanisms such as journalizing, creative outlets, or participating in support groups. This is for her to provide an outlet to express her emotions and find solace. The fourth one is to acknowledge and validate the client's grief and provide reassurance that their feelings are valid and normal. This can reduce the feelings of isolation and loneliness. And for the last one is to involve the client's partner, family members, or friends in the support process if desired by the client. Involving family and friends can provide a network of emotional support. For the evaluation is after 1 hour of nursing interventions, the patient demonstrated effective coping mechanism and shows an acceptance toward the situation.
So good evening, ma'am. My name is Rica Apolonio together with Isabel Balao and Gazel Soriano to discuss the course in the ward. Next slide. So prior to admission, the physician's order are the following. So upon admission of the patient, the doctors ordered the following. By manual exam, the rationale for this is that to check the patient's internal pelvic organs. The nursing responsibilities are the following: secure patient's consent, obtain the patient's health history, ask list of patient's current medication, explain that pap smear is painless, avoid interfering factors, and empty the bladder. So the doctor ordered laboratory test consisting of complete blood count. This is to provide information on the hematologic system as well as other body system. This is commonly performed that is included as a part of routine checkup. The nursing responsibilities are the following: explain test procedure, explain that slight discomfort may be felt when the skin is punctured, encourage to avoid stress if possible because altered physiologic status influences and changes, normal hematologic values, explain that fasting is not necessary, however, fatty meals may alter some test results as a result of lipidemia, apply manual pressure and dressing over the puncture site, and then monitor the puncture site for oozing or hematoma formation. And then finally is instruct the resume of normal activities and diet. Next slide. Next is hematocrit. The rationale for this is that it's a part of complete blood count. This is to determine the percentage of the red blood cells in the blood. The nursing responsibilities are the following: interview patients, collect labs such as blood and urine samples, provide patient education, communicate with the healthcare team, review lab results, administer medications including IVs, infusions, assist with bone marrow biopsies, and perform blood transfusions. Next is hemoglobin. A hemoglobin test is often used to check for anemia, a condition in which the body has fewer red blood cells than normal. The nursing responsibilities are the following: assess the severity, frequency, and activities that aggravate fatigue, assess laboratory values, set realistic goals, administer medications as needed, provide supplemental oxygen, eat iron-rich foods, assess the degree of activity intolerance, and assess the patient's oxygen saturation. Next is measuring the HCG. The rationale for this is that measuring the HCG levels can be helpful in identifying a normal pregnancy, pathologic pregnancy, and can also be useful following an aborted pregnancy. The rationale for this is that patients should not, rather the nursing responsibilities, the patient should not restrict food but should restrict fluids for 8 hours before the test. Inform the patient that the test requires a first voided morning specimen or urine collection over a 24-hour period depending on whether the test is qualitative or quantitative. Next slide. Next is platelet count. The rationale for this is to monitor or diagnose disease or to look for the cause of too much bleeding or clotting. The nursing responsibilities are the following: perform a thorough physical examination, assess vital signs, monitor lab values, continuously monitor coagulation values, provide antidotes as necessary, review and identify medications that can increase the risk of bleeding, provide medications as ordered, prepare and assist in platelet transfusion. Next is the white blood cell count. The rationale for this is it would help in diagnose disorders related to having high white blood cell or having low white blood cell count. The nursing responsibilities: prevent blood culture contamination, clean the collection site prior to drawing blood to prevent contamination and false positive. Next is Rh factor. The rationale for this, it is used to indicate whether the blood of the two different people is compatible when mixed. It is routine and important that the Rh factor for a mother and unborn child be determined during pregnancy. The nursing responsibilities are the following: confirm the patient's identity using two patient's identifiers according to facility policy. Explain to the patient that the Rh typing determines or verifies blood group to ensure safe blood transfusions. And inform the patient that he or she doesn't need to restrict food and fluids for the test. Next slide. Next is blood typing. This is to determine the blood type group, the blood type and the blood, or rather the blood group of the mother. The nursing responsibilities are the following: find the current type and cross-match, obtain informed consent and health history, obtain large bore intravenous access, assemble supplies, obtain baseline vital signs, obtain blood from the blood bank. And next is antibody screen. So the rationale for this is that this test is used to determine the patient's level of immunity to certain infection, and the nursing responsibilities are the following: stay at the patient's bedside and monitor vital signs. They should inform the patient of potential symptoms of reaction and document any abnormal findings. Next is ultrasound. So the rationale for this is that it is used to visualize the products of conception, monitor fetal growth and obtain fetal measures and measure amniotic fluid volume. The nursing responsibilities: perform an ultrasound, um, perform the ultrasound and ensure that the mother has full bladder at that time. Instruct the mother do not void before the procedure and explain the patient the procedure and its purpose. Next slide. Next, the doctor ordered for pelvic exam. The rationale for this is to check for abnormalities and infections. Also, a pelvic exam can help the doctor to evaluate the size of pelvis and cervix. This will help them to evaluate whether the cervical weakness could lead to miscarriage or preterm labor. The rationale for this is to secure patient's consent, obtain the patient's health history, ask list of the patient's current medications, explain that pap smear is painless, avoid interfering factors, and empty the bladder. Next is in nucleic acid amplification testing, or NAAT. So the rationale for this is for screening test for gonorrhea and chlamydia for patient C and her husband. The nursing responsibilities: ensure the patient's privacy, establish rapport, provide patient education about the procedure. Next slide. Upon admission, so day 1, the doctor ordered the following: administer IVLRS with 18-gauge needle. The rationale for this is that the patient did not show any signs of hypervolemia or hypovolemia. Thus, the doctor ordered an isotonic solution and had slightly bleeding. So the nursing responsibilities: assess the IV site, priming and hanging a primary IV bag, preparing and hanging a secondary IV bag, calculating IV rates, and then monitor the effectiveness of IV therapy. Next is to give oxygen 6 to 10 LMP via face mask. So oxygen regulated at 6 to 10 liters per minute by a face mask to replace intravascular fluid loss and provide adequate fetal oxygenation. The nursing responsibilities are the following: place the patient in upright position as clinically appropriate, evaluate patient's response to oxygen therapy including airway, respiratory rate, pulse oximetry reading, and reported dyspnea, and then institute additional interventions to improve oxygenation as needed. Next slide. And then the doctor ordered for laboratory test results. Complete blood count. So the rationale for this is to provide information on the hematologic system as well as other body systems. This is commonly performed that is often included as a part of routine checkup. So the nursing responsibilities are the following: explain test procedure, explain that slight discomfort may be felt when the skin is punctured, encourage to avoid stress if possible because altered physiologic status influences and changes normal hematologic values, explain that fasting is not necessary. However, fatty meals may alter some test results as a result of lipidemia. Apply manual pressure and dressing over the punctured site. and then monitor the puncture of site for oozing or hematoma formation, and then finally instruct to resume normal activities and diet. Next slide. Next is hemoglobin. A hemoglobin test is often used to check for anemia, a condition in which the body has fewer red blood cells than normal. The nursing responsibilities are the following: assess the severity, frequency, and activities that aggravate fatigue, assess laboratory values, administer medication as needed, provide supplemental oxygen, eat iron-rich foods, and assess the degree of activity tolerance and assess the patient's oxygen saturation. Next is hematocrit. Hematocrit, pakibalik. Next for hematocrit. Hematocrit is a test a part of complete blood count. This is to determine the percentage of RBC in the blood. The nursing responsibilities are the following: interview patients, collect labs such as blood and urine samples, provide patient education, communicate with the healthcare team, review lab results, administer medications including IV infusions, assist with bone marrow biopsies, and perform blood transfusions. Next slide. Next is HCG. The rationale for this is measuring HCG levels can be helpful in identifying a normal pregnancy, pathologic pregnancy, and can also be useful following an aborted pregnancy. The nursing responsibilities are the following: patients should not restrict food and should restrict fluids for 8 hours before the test, and inform the patient that the test requires a first voided morning specimen or urine collection over a 24-hour period depending on whether the test is qualitative or quantitative. Next is platelet count. The rationale for this is to monitor or diagnose disease or to look for the cause of too much bleeding or clotting. The nursing responsibilities are the following: perform a thorough physical examination, assess vital signs, monitor lab values, continuously monitor coagulation values, provide antidotes as necessary, review and identify medications that can increase the risk of bleeding, and provide medications as ordered, and prepare and assist in platelet transfusion. Next is WBC count. So the rationale for this is this would help diagnose disorders related to having high white blood cell or low white blood cell count. The nursing responsibilities is to prevent the blood culture contamination, clean the collection site prior to drawing blood to prevent contamination and false positives. Next slide. Next is skin test for ceftriaxone. The rationale for this is to rule out if the patient have allergy to the antibiotic. The nursing responsibilities are the following: monitor signs of pseudomembranous colitis including diarrhea, abdominal pain, fever, pus or mucus in stools, and other severe or prolonged GI problems such as nausea, vomiting, and heartburn. Appropriate specimens should be obtained for isolation of the causative organism and for determination of its susceptibility to the drug. Next is the doctor ordered single dose of 500 milligrams of intramuscular dose of ceftriaxone after negative skin testing. This antibiotic is given for treatment of gonorrhea. The nursing responsibilities are the following: monitor signs of allergic reactions and anaphylaxis, including pulmonary symptoms like tightness in the throat and chest, wheezing, cough, dyspnea, or skin reactions such as rash, brutus, and urticaria. Next, the doctor ordered for skin test for gentamicin. The rationale for this: if the patient has positive results in skin test for ceftriaxone, have the patient take another skin test for gentamicin. So the nursing responsibilities is to determine creatinine clearance and serum drug concentration at frequent intervals. Next slide. Next, the doctor ordered, if positive for allergy in ceftriaxone, give 240 milligrams via intramuscular dose gentamicin plus adding a single dose of 2 grams of azithromycin per orem. This is for the treatment of gonorrhea. And then give doxycycline 100 milligrams per orem twice a day for 7 days. The rationale for this is doxycycline is an antibiotic treatment for chlamydia. And the nursing responsibilities are the following: monitor signs of hypersensitivity reactions or anaphylaxis, including pulmonary symptoms such as tightness in the throat and chest, wheezing, cough, and dyspnea. or skin reactions such as rash, angioedema, pyotus, and urticaria, and then notify physician or other nursing staff immediately if these reactions occur. Next slide. Next is prior to admission, secure the admission slip. The rationale for this will imply that the patient agreed to be admitted in the hospital. The nursing responsibilities are the following. Record all vital signs. The nurse starts the process of diagnosing the patient by taking metrics of patient's vital functions, coordinating with physicians, preparing patients for operation, and obtain an associate degree, meet state regulation and time management. Next, the doctor ordered secure informed consent for surgery. This will serve as a legal basis and document for the court. The nursing responsibilities are the following. Ensure patient comprehension, facilitate documentation of consent, address patient anxiety, and identify the appropriate surrogate decision maker and when needed. Next slide. So day 2, this is prior to surgery. So the doctor ordered the following. Continue administer IV LRS to run 24 hours. The rationale for this is to provide electrolytes and for medication route. And the nursing responsibilities, observe aseptic technique, verify doctor's order, and review the medication administration record. Next is to monitor vital signs. The rationale for this is to ensure that the patient vital signs are within normal range. Next, the nursing responsibility, observe the monitor, looking out for certain abnormalities and deviations as well as ensuring the setup is adjusted correctly. Next, the doctor ordered nothing per orem for 8 hours prior to the surgery. The rationale for this is that the nothing per orem order is common before any procedure that requires anesthesia or sedation. The reason for doctors give NPO instruction is because having a full stomach can raise the risk of serious health issues from sedation and anesthesia. The nursing responsibilities, they aim to prevent potential delays in treatment that occur when inadvertent ingestion of food and drink leads to cancellation of procedures. Next, the doctor ordered for to collaborate with the surgical team. The rationale for this is that this is to prepare the OR room and inform the attending doctor like the surgeon and anesthesiologist for the surgery. The nursing responsibilities are the following. This involves communicating with and coordinating care with fellow nurses and other clinicians, administrators, and staff. Collaboration also involves including patients and their families in care decisions, which means communicating appropriately, empathetically, and lay people. Next slide. Next, the doctor ordered for dilation and evacuation. The rationale for this is to evacuate the products of conception. The nursing responsibilities are the following. If bleeding is profuse, place the woman flat in bed on her side and monitor uterine contractions and fetal heart rate through external monitor. Also measure the intake and output to establish renal function and assess the woman's vital signs to establish maternal response to blood loss. Next, the doctor ordered for continue taking the doxycycline 100 mg per orem for twice a day for 7 days. The rationale for this is that the doxycycline is an antibiotic treatment for chlamydia. The nursing responsibilities are the following. Monitor signs of hypersensitivity reactions or anaphylaxis, including pulmonary symptoms such as tightness in the throat and chest, wheezing, cough, dyspnea, or skin reactions such as rash, angioedema, pyotus, urticaria, and notify the physician or the nursing staff immediately if these reactions occur. Next slide.
Good evening, ma'am. I am Isabel Balao, and I'm going to continue presenting upon admission day 3 and 4. So physician's order is to monitor vital signs. Rationale is to ensure that the patient vital signs are within normal range. Nursing responsibilities is observe vital signs, monitor, looking out for certain abnormalities and deviations, as well as ensuring the setup is adjusted correctly. Next, routinely cleaning incision wound. This is to prevent debris and microorganisms reside on the wound site. Nursing responsibilities are cleaning wounds, dressing wounds, figuring out the appropriate treatment for the complex wounds, teaching patients and caregivers how to properly tend a wound.
creating a care plan for the patient to follow at home, reporting on and maintaining an up-to-date health record. Next is give ferrous sulfate orally for supplement on the blood loss during surgery. Nursing responsibilities are to instruct the patient to dilute liquid iron preparations with juice or water, administer through a straw, and rinse the mouth after taking the medication. Since excessive amounts of iron is toxic, accidental or intentional overdose leads to poisoning. Next is give paracetamol. This is for the fever of the patient. Assess the patient's pain level before administering the medication. Next, physician's order is the assessment for skin integrity. Rationale is this is to check if the skin is intact after surgery. Nursing responsibilities. A thorough skin assessment should include bony prominences, dependent areas, and affected extremities for pallor, redness, and breakdown. Collect patient history, including risk factors and symptoms. Next physician's order is to assess for trauma. Rationale is to ensure the absence of complication during post-operation. Nursing responsibilities look for penetrating injuries, palpate for step-offs along the spine, evaluate for bruising and bony tenderness, perform a full neurologic exam, including testing the cranial nerves, strength, sensation, coordination, and reflexes. Next is to assist the patient for early ambulation. Rationale, this is to promote faster healing and to promote invol- involution of the uterus. Nursing responsibilities is to explain to the client how far you'll be walking with them and how you will assist them. Check if they need an ambulation device like a cane or walker. Make sure that the route is not slippery and that there are no obstacles on the way. Next slide. For D4, physician's order is to monitor vital signs. This is to ensure that the patient's vital signs are within normal range. Nursing responsibilities observe the vital sign or observe and monitor the vital signs, looking out for certain abnormalities and deviations, as well as ensuring the setup is adjusted correctly. Routinely cleaning incision wound. This is to prevent debris and microorganisms reside on the wound site. Nursing responsibilities, cleaning wounds, dressing wounds, figuring out the appropriate treatment for the complex wounds, teaching patients and caregivers how to properly tend a wound, creating a care plan for the patient to follow at home, reporting on and maintaining an up-to-date health record. Next physician's order is to monitor input and output. This is to give awareness for signs of early surgical complications such as bleeding and infection. Nursing responsibilities is to educate the patient about the procedure. Next is assessment for skin integrity. This is to check if the skin is intact after surgery. And a thorough skin assessment should include bony prominences, dependent areas, and affected extremities for pallor, redness, and breakdown. Collect patient history, including risk factors and symptoms. Next is to assess for trauma. This is to ensure the absence of complication during post-operation. Nursing responsibilities look for penetrating injuries, palpate for step-offs along the spine, evaluate for bruising and bony tenderness, perform a full neurologic exam, including testing the cranial nerves, strength, sensation, coordination, and reflexes. Next physician's order is to assess patient for early ambulation. Rationale, this is to promote faster healing and promote involution of the uterus. Nursing responsibilities is to explain to the client how far you'll be walking with them and how you will assist them. Check if they need an ambulation device like a cane or walker. Make sure that the route is not slippery and that there are no obstacles. Next is continue taking doxycycline 100 milligrams orally for 7 days. Doxycycline is an antibiotic treatment for chlamydia. This is a nursing diagnosis is mild diarrhea, photosensitivity, photosensitivity, nausea, vomiting, skin rash, itching, headaches, and tooth discoloration.
So, good evening, ma'am. I'm Liza Felix Rayana, and I'm going to continue for day 5 and day 6. So, doctor's order is CBC. The rationale of this is to provide information on the hematologic system as well as other body system. This is commonly performed that is often included as a part of a routine checkup. Nursing responsibilities or explain test procedure. Explain that slight discomfort may be felt when the skin is punctured. Encourage to avoid stress if possible because altered physiologic status influences and changes normal hematologic values. Explain that fasting is not necessary. However, fatty meals may alter some test results as a result of lipidemia. Apply manual pressure and dressing over puncture site on a removal of dinner. Monitor the puncture site for oozing and hematoma formation. Instruct to resume normal activities and diet. Next is physician ordered HGB. The rationale of this is hemoglobin test is often used check for anemia, a condition in which the body has fewer red blood cells than normal. Nursing responsibilities are assess the severity, frequency, and activities that aggravate fatigue, assess laboratory values, set realistic goals, administer medications as needed, provide supplemental oxygen, eat eat iron-rich foods, assess for degree of activity intolerance, assess the patient's oxygen saturation. Next is the WBC. The rationale of this is to diagnose disorders related to having a high white blood cell count, having white blood cell count or low white blood cell count. For nursing responsibility, encourage to avoid stress is if possible because altered physiologic status influences and changes normal hematologic values. Explain that fasting is not necessary. However, fatty meals may alter some test results as a result of lipidemia. Apply manual pressure and dressings over puncture site or removal of dinner. Monitor the puncture site for oozing and hematoma formation. Instruct to resume normal activities and diet. Is hematocrit. The rationale of this is hematocrit test is part of a complete blood count. This is to determine the percentage of red blood cell in the blood. Nursing responsibilities are carefully assess the patient with a low hematocrit for his or her ability to tolerate physical activity. Next is to monitor the vital signs. And the rationale of this is to ensure that the patient vital signs are within normal range. The nursing responsibilities are observe the monitor, looking out for certain abnormalities and deviations, as well as ensuring the setup is adjusted correctly. Next is monitor I and O. This is to give awareness for signs of early surgical complications such as bleeding and infection. Nursing responsibility is educate the patient about the procedure. Next is to assessment for skin integrity. This is to check if the skin is intact after surgery. Nursing responsibility is a thorough skin assessment should include bony prominences, dependent dependent areas, and affected extremities for pallor, redness, and breakdown. Collect patient history, including risk factors and symptoms. Next is assess for trauma. Rationale of this is to ensure the absence of com- complication during post-operation. Nursing responsibilities are look for penetrating injuries, palpate for step-ups along the spine, evaluate for bruising and bony tenderness, perform a full neurologic exam including testing the cranial nerve, strength and sensation, coordination and reflexes. Next is to assist patient for early ambulation. Rationale of this is this is to promote faster healing and to promote of involution of the uterus. Nursing responsibilities are explain to the client how far you'll be walking with them and how you will assist them. Check check if they need an ambulation device like a cane or walker. Make sure the route is not slippery and that there are no obstacles. Next is doc, continue taking doxycycline 100 mg per RM twice a day for 7 days. Rationale is rationale of this is doxycycline is an antibiotic treatment for chlamydia. Nursing responsibilities are monitor signs of hypersensitivity reaction or anaphylaxis, including pulmonary symptoms such as tightness in the throat and chest, wheezing, cough, and dyspnea, or skin conditions such as angioedema, pruritus, um, urticaria, and next is to notify physician or nursing staff immediately if these reactions are occur. For day 6, discharge patient by afternoon. The rationale of this is if patient shows stable vital signs and laboratory examination, and if the patient is already able to ambulate by herself, she is expected to be discharged by afternoon. The nursing responsibility is safety. Is your home a safe place for for your recovery? Transportation. How will you get home from the hospital? Food. Do you have food and other necessities at home? For medication, do you have all of the medication you need for a doctor's appointment? What is your follow-up care? Next is to review discharge plan. The rationale of this is to instruct the patient on what medication should be taken at home after discharge. The responsibility is start planning before or on admission. Identify whether the patient has simple or complex needs. Develop a clinical management plan within 24 hours of admission. Coordinate the discharge for a transfer process.
And that brings us to the end of our presentation. Thank you for listening. Here are the following references that we used from our case study.